Good afternoon, everybody. My name is Richard Hetke, and I'm the Executive Director of the American Association of Dental Boards, or AADB. AADB is a sole association for state dental boards. We count over 600 members, including 49 of the 50 state dental boards and over 400 individuals who sit on state dental boards or work for or with state dental boards. AAD provides a forum for the exchange of information among state dental board members, access to a lot of very critical data, representation and advocacy in front of governmental organizations or other professional and trade associations, and a wide range of services. And one service that we're actually inaugurating today is a series of teleseminars. Our first program today will discuss issues relating to the use of lasers in the dental office. Now, before I introduce your moderator, a few ground rules. The panel presentation will last for approximately 45 minutes, give or take a few minutes. All of the audience lines, all of the people who've dialed in for the call, have been muted. You may, in the spirit of a belt and the suspenders, also want to mute your own phone, or cell phone, but all of your lines have been muted. After the conclusion of the presentation, we'll have a question and answer session. Now, a few questions have been forwarded before the program, but for anyone in the audience who'd like to ask a question, a real-time question, you may email those questions immediately to one of our AADB staff members, Donna Adler. Donna is watching her monitor right now. Her eyes are glued to the monitor, and when she receives a question, she will immediately flip it out to all three of the panelists. Donna Adler's email address has been provided in a couple of the notices and promotional pieces, but I'll give it to you again right now. In all lowercase letters, it's D. Adler, D-A-D-L-E-R, at dentalboards.org. Dental boards all together and with an S at the end, .org. Again, D. Adler at dentalboards.org. So let's get started. I'd like to introduce your moderator for today's program, Ms. Angie Wallace. Angie has over 30 years of experience as a clinical hygienist. She is the current co-chair of the Academy of Laser Dentistry's Regulatory Affairs Committee. Angie has a basket full of national awards and recognitions, too many to cite now because it would take up half the seminar. She lectures nationally, but still finds time to work clinically 4 days a week. She has long been a member of the American Dental Hygiene Association. Angie lives with her husband and family in Tulsa, Oklahoma, and I might add she's been a pleasure to work with as we've developed this program. So Angie, take it away.
Thank you so much, Mr. Hetke. As you said, my name is Angie Wallace, but I do want to introduce the rest of my panel as well. The first one is Dr. Keith Brewster from Dallas, Texas. Dr. Brewster graduated from Baylor College of Dentistry in 1984. He has continued his education with advanced training in orthodontics, CEREC, 3D imaging, cosmetic dentistry, occlusion, TMJ, and implant surgery. He holds standard proficiency certification in both the Erbium YAG and the ND-YAG laser wavelengths and achieved ALD fellowship. Dr. Brewster serves on the ALD Board of Directors and is co-chair of Regulatory Affairs and previously of ALD's Laser Safety Committee. He maintains membership in AAID, AACD, and AOS. He practiced general dentistry in downtown Dallas, and his email address is listed on a sheet that should be emailed to you if you need to reach him by email. Gail Siminovsky is our Executive Director of the Academy of Laser Dentistry. Gail is in a leadership professional as Executive Director of the Academy of Laser Dentistry and has served as the ALD Board as an advisor. She has 18 years in leadership and 28 years in marketing, public relations, educational program development, and business. She is a graduate of SUNY Binghamton and maintains the credential of Certified Association Executive from the American Association of Executives. She serves on the ASAE Small Staff Advisory Committee and on the Board of Directors for the Florida Society of Association Executives. And once again, you also should have her email address if necessary. So I just want to let you know our goal today is to provide enough information for you to begin to ask and answer questions relating to dental laser education and safety. So let's get started. An overview of today's podcast will cover, first, laser safety, second, basic concepts of lasers, third, should lasers be considered as a different tool than any other tool that a dental hygienist can use? Next, do we need to consider any special training? Also, what are states doing with hygiene and the use of lasers? ALD gets numerous questions weekly regarding which states allow the use of lasers, and ALD has educational plans to post our interpretation of what all states say about hygienists using lasers. Finally, this is something that we would love to have your help and suggestion and have this information more readily available to our profession. Our first question is, laser safety is the first we want to address. As we begin our program today, we have been asked to help listeners understand what lasers can be used for and how important safety is to using lasers. Two things that need to be considered are making sure that safety glasses are used for the clinician, the assistant, the patient, and anyone else in the laser safety zone. We also need to make sure that the plume that contains several toxins has high volume suction to remove that plume, just like we do with a Cavitron. Dr. Brewster, I'm sure you can add a few more things on laser safety for us.
Each laser has a specific optical density that is required for each laser. Learning that is part of the educational process. Our guidelines are dictated by ANSI, guidelines for lasers, and that everyone in the safety zone must have safety glasses on while the laser is being used.
And Gail, can you give me some other guidelines that you know about?
Well, we do. ALD does base its suggestions on the American National Standards Institute, the ANSI guidelines, where we find that they indicate that there must be a designated laser safety officer in the facility. That designated laser safety officer can be the dentist, the hygienist, an assistant, or anyone else in the dental office. The Laser Institute of America, LIA, which some of our listeners may be aware of, is the secretariat for the ANSI guidelines and includes specifics for medical and dental facilities.
Perfect. Thank you. The next question that I've kind of grouped together have several topics that we will look at separately. Understanding the basics of lasers, the attraction to what chromophore, procedures that can be done, settings that should be used with a laser, insurance codes, and then documentation in the patient's chart. So we know that the lasers many of our laser users and listeners may be familiar with the diodes, the Nd:EG, the CO2, and the erbium lasers. But Dr. Brewster, if you can give us a big description of everything with the lasers, that would be very helpful for us.
The lasers have different wavelengths that they work with. Like the visible light spectrum, each wavelength has a different interaction with chromophores. As visible light gives a reflection of leaves in the summer of a green color from the chlorophyll. In the fall, when the chlorophyll is gone, the leaves reflect the reds and yellow. This is how the different chromophores are affected by the wavelength. This also is how that the target tissue can be affected by the different wavelengths that you're trying to interact with the power settings and frequencies to fine-tune the interaction of the specific interaction, the healthy tissue, and leave the healthy tissue unaffected when the setup is correctly. Dental lasers have a wide spectrum of procedures that can be done safely, from hard tissues procedures on teeth and bones to soft tissues to treating herpetic lesions non-invasively. Tongue ties is an example on newborns to the point that they cannot nurse to immediate relief for the mother. Be able to nurse. To doing a biopsy for pathology that is pathless and without sutures and heals much faster than the scalpel and sutures. Periimplantitis issue shows real promise for specific wavelengths to the point that is now a major subject matter for the AADB and periimplantitis studies at major universities. Lasers can be used in daily practice to improve patient comfort and precision. Lasers reduce the need for injectables or anesthetics when you're doing a simple Class 1 or Class 2 and a 2. Or they can coagulate as you work, trying to clean up an impression or a digital scan for digital dentistry. Or we can reduce the power and increase the time between active lacing and follow periodontal needs such as fresh bleeding need for periodontal attachment. We can use lasers for treating soft tissue applications such as abscesses, ulcers, periodontal cosmetic procedures, cranectomies. The dentist use a hard tissue for preparation of hard tissue or teeth, which pediatric dentists will really like because they can reduce the anesthetic needed and reduce the chair time for the pediodontist. Angie, would you like to take some time to discuss the values of lasers for the hygienist?
Absolutely. In dental hygiene, lasers can be used for several things, again, depending on each state's Practice Act. Here are a few procedures that several states allow. Laser bacterial reduction, which would be the reducing of bacteria around the normal healthy sulcus to prevent toxins from entering into an aerosol. Periodontal therapy, which would be known as laser-assisted periodontal therapy, or in some situations the scaling and root planing and then adding laser into that procedure. This is used in conjunction with that scaling and root planing and will help aid in reduction of those deeper periodontal pockets by creating an environment to allow healthy tissue. Using that laser to activate a bleaching solution is another option of what lasers can be used for in hygiene. Herpetic lesions and aphthous ulcers. This is an exciting application to help lower the pain that is often associated with those lesions. And the newest addition is to use lasers that are considered for photobiomodulation and has been known also as biostimulation or low-level lasers. Now, of course, all of these have something to do with state practice acts, so different states are allowing those. Some states are saying, no, a hygienist cannot use those particular applications. And all of these lasers that I've mentioned earlier hopefully will become something that lasers can be used for in the hygiene department. We've had wonderful advancements with lasers in hygiene and excited for our patients on the treatment we can potentially provide for them. Gail, I think you had something else that you could add into this as well.
Yes, I wanted to share that going back to the different types of laser wavelengths, diodes, Nd:YAG, CO2, and erbium lasers. Specific to their wavelengths, the U.S. Food and Drug Administration is the regulatory body that clears devices for marketing. I'm sure our audience listeners are very well aware of that, noting indications for use for each device. And we follow the FDA regulations for what can be brought to the marketplace in terms of what lasers are on the market and available to dentists to purchase. Each year, we've tried to provide to our constituents a compilation of the FDA marketing clearances by indications for use and by wavelengths, including a checklist for evaluation of lasers. And we try to update this. We do update this annually. It's a document that would be available to our professional as well.
Perfect. All right. To go on to our next question, what settings should be used for procedures? Basic settings to help give them some type of an idea of how a laser can be used and how little power is really needed for each procedure. Keith, if you can help me answer this question, that would be great.
Each laser has a different wavelengths that are better suited for different procedures. For example, the CO2 laser is better suited for oral surgeons and general surgeons because of its precise and clean incision. It's also used for thoracic surgeries for this reason. Erbium YAG, which is used in dentistry, is also used for LASIK eye surgery, which is making a much more precise improvement over the old radiokeratotomy surgery. The laser can also be used in the heart surgery for the precise abatement of Purkinje fibers in the heart to help control erratic heartbeat. The precise and controlled surgery through setting powers that makes this used for such a wide spectrum. The setting for hygiene is very low and very selective for the interaction. It leaves the healthy tissue unaffected while its main action is on the bacteria and unhealthy tissue.
That's a perfect explanation of everything. So a doctor can use it in a surgical setting where a hygienist is basically subsurgical, so the wattage is so much lower that it's not going to be used for any type of cutting tissue, so that's very important to note. All right, our next question is, what are codes that can be used with lasers? There aren't any specific codes for lasers in any of our literature for insurance companies, but that it's being used with procedure that is being completed, and the lasers are incorporated into that procedure. So the best part is to make our job easier and more precise, and then you bill for the procedure that's being completed. Dr. Brewster, I think you might have more to add to that as well.
The main benefit of the lasers when they're used right is an improved procedure, therefore better healing and outcomes, which is better for the doctor and the patient. That's one of the biggest things. Go ahead.
Oh, no, go ahead. Finish your sentence. I'm sorry.
And that's one of the biggest benefits of the lasers and the settings and the variations that you can set them up with.
Perfect. And Gail, how about for you?
Yeah, I just would like to reiterate your first point in that, we view lasers as simply another tool or an instrument for use in daily patient care. So it's the procedure that is being performed that is what should be billed for, not the apparatus used.
Perfect. Very good. So how important, the next question is, how important is documentation of lasers in the patient's chart? I don't think I can stress this one enough. Correct documentation needs to be placed into charts, including the laser setting that you used, the time that the laser was used, and postoperative instructions given to the patient, as well as that safety glasses were being used, not only by the clinician, but also the patient and anyone else who entered that laser safety zone. Dr. Brewster, I think you said you had a tip on with different softwares and things that you can do with that as well.
I've been a beta tester with EagleSoft for probably 10 to 15 years. I can't remember exactly how long ago. I've done several testings with them. You can set up templates in your software where it's pretty much a plug and play, which makes all this information easy to put in. You plug in the numbers, which you record off the laser settings, and your charting is done pretty well automatically and standardized.
Makes everybody's job much easier for sure, but very important to make sure that you include that in your charts, especially when a laser is being used. All right, on to our next question. Laser users want to understand what they can do or not do with lasers. Many doctors want to know how lasers are different from using an electrosurge or scalpels. So many times doctors think that they can use the same procedure with a scalpel or an electrosurge, and the scalpel will not allow the hemostasis to occur, and the electrosurge unfortunately causes so much damage to the tissue that the discomfort is very high for the patient.
With the laser, you can control your collateral damage, can be greatly reduced, and healing is much quicker and less painful for the patient. Again, when the correct wavelength is used, the settings are correct, and you use the laser for the tissue you're treating.
Perfect. All right, and the next question. Should lasers be considered to be different than any other tool a dental hygienist can use? This one comes across to us a lot. There used to be a procedure that was called curettage, and that is no longer an accepted procedure in periodontal literature for a dental hygiene procedure. This is because we had no way of knowing if we were, quote, cutting healthy tissue when we were completing that task, or possibly leaving diseased tissue behind in the periodontal pocket. So this is where the laser is ideal for affecting the diseased tissue and leaving the healthy tissue unaffected, which is a very important concept, is that it only works with certain cells. So, Dr. Brewster, what can you add on to that for me?
Again, I want to refer to the wavelengths and settings for the procedures and how you can optimize the laser to take advantage of the properties to get the outcome desired. I also want to make the point that all lasers are not the same. Knowledge and experience can enhance the outcomes. I think the manuals that come with lasers are a good starting point and can be used as training to get started. It's a good thing. But you should not just start using the laser without understanding the science and the properties of interactions to get the best outcome, which comes from education and experience.
Very good point. It's like anything else, there's no such thing as too much knowledge and education to be able to perform the tasks that you want to complete. All right, our next question is special training needed to use laser? And that kind of goes back to what Dr. Brewster was just talking about. The Academy of Laser Dentistry doesn't sell lasers. It's very important that we get that across, but we do provide education. This is to help dentists and hygienists better understand what they are doing with their lasers so that the patient and the dental teams are safe. Dr. Brewster, your perspective as a dentist is very important that the listeners hear, and on what level of training should be considered.
Manufacturers provide operational guidelines and owner manuals for basic knowledge. The science and basic of the wavelengths are taught by continuing education that is meeting the standards that are recognized by organizations such as AGA, ADA, AGD, ADA CERT, etc. We have members on the board that are on the regulation organizations I've just mentioned that help write the guidelines from the ANSI, ADA, FDA, etc. are willing to help answer any questions that come up during the board deliberation on each state's regulatory decisions, and they are willing to help at any time they are asked.
Perfect. And Gail, can you give me a little bit of background for our listeners about the Academy of Laser Dentistry?
I'd be happy to. Thanks, Angie. So for our listeners, the Academy of Laser Dentistry is an organization that's committed to oral health through laser technology. That's our mission. Very simple. When the ALD was formed by a group of researchers, academicians, and clinical dentists almost 25 years ago, we're actually celebrating our 25th anniversary in 2018, and we're very excited about that milestone. One defined need way back then was to develop and offer continuing education and a certification program where dental professionals could voluntarily demonstrate their knowledge. The founders at that time felt that an understanding through an independent program, in addition to whatever the manufacturer might share in their operator's manual, an independent program that's based in science is what dentistry needed. They knew that it would take a long time for this technology to be fully embraced by the profession. And so at that time, ALD developed 3 defined certification levels, and we annually provide for scientific discussion, presentation, and debate about the technology at our annual session. Our job, very similar to part of the mission of the American Association of Dental Boards, is to be a vehicle for information and conduit for the exchange of moving our profession forward. And to meet that mission, part of what we're doing today actually is talking directly to that by sharing the information that we know with another association. So regardless of whether or not some state regulatory boards decide what they need to do to regulate, they do find additional education from us helpful beyond what the manufacturer might provide, is necessary to be a safe user. There are some state regulatory boards that have sought out information from the Academy of Laser Dentistry, and those dialogues have always been well received. Dr. Brewster, I think you had something else about regulatory experience that you'd like to add to the group.
When I joined the ALD 10 years ago, I found a group that was very passionate and willing to share and mentor new users, showing knowledge and experience openly. They don't endorse any laser manufacturer over the other, but wanted to get the best benefit from laser you have and give them the benefits and limitations for each wavelength. I have 6 wavelengths in my office, including Fellscope, which is really not an interactive, but is a differential. It helps differentiate the cancer cells through fluorescence, looking for increased cellular activity and how the wavelength is reflected or absorbed. That's an example of how the different wavelengths interact with the tissue differently and can be used to our benefit.
Perfect. All right. So now we're going to get into a little bit more about the questions that come into place about what the states are doing with hygiene use of lasers. Each state has the opportunity to regulate their own state practice act and their scope of practice, deciding if doctors and hygienists using lasers under their license with the said state. The main concern by us is that lasers are not just being picked up and used without some knowledge and basic concepts of what the tool in front of them can provide. Dr. Brewster, I know you have helped so much with different states. What is your take on how we want to handle that in the future?
Basically, we are here as an educational and informational group for y'all. We do not want to influence you in any way. We just want to give you all the information you have to make your decisions. I think Gail has something to say here, and then we'll come back to that a little bit later.
Yeah, thanks, Keith. Several state boards, as I mentioned before, have used ALD to help them in setting up some regulation that can help their constituents to ensure public safety. So our job is to be ready to assist and answer any questions you might have to help you to do your job in seeking a better understanding of the technology and its uses in dentistry, and to better help you to make your decisions regarding education or regulation or relicensure. And Dr. Brewster, I think you did want to add something here.
I did want to add that the ALD is an unbiased scientific organization that mainly is working on educational and trying to get educational out for the lasers. We don't endorse any company over one another, and our goal is to promote education and share experience and knowledge among our profession.
Perfect. And I'm just going to add one thing on that. One thing that I say when I'm teaching classes is I tell all of my students that without a laser, I feel like I would quit dental hygiene because I've seen what's done for my patients and what my patients have acknowledged as far as what they know the laser has done for them. I feel that if I wasn't using it, if I quit using it, my patients would seek other offices that would potentially be using the laser because they see the benefits as well. So our next question is regulation needed for dentists and hygienists? This is really up to each state to determine what their state practice consists of and what's necessary to ensure safety, which, of course, is what we have been talking about the entire time. Academy of Laser Dentistry stands ready to assist as needed. States like Nevada, Arizona, and Wisconsin have regulations stipulating CE requirements for relicensure. Some states' regulations don't address this topic, while others do with sometimes inaccurate information about safe laser use. Dr. Brewster, I know you've had a ton of experience with Texas as they went through some of these growing pains with implementing lasers into dental hygiene. Could you give us a brief description of what took place there?
I went to all 3 board hearings in Texas and spoke on the need for education beyond what the manufacturers give to the clinicians. So I'm going to include the education with the purchase, which is what I experienced in my first laser and got me started with ALD. They actually sent somebody to my office and taught me for a whole day. Another dentist taught me for a whole day to use the laser, and also got me my first year membership in ALD. That's what got me started in ALD. The percentage of participation needs for education, if they are available, is not what needs to be. For example, with Corona, the only company I can tell you that I know of that I work with includes continuing educational courses with the purchase of the lasers that fill the requirements and the participation as is required by the ANSI guidelines. Maybe 50%, even though it is included in the purchase, don't participate in the education. Texas made the decision to have 8 hours of lecture in science, tissue interactions, with 4 hours of hand-on use, including simulation with a pig jaw to give experience with the tissue interaction that we can show how the different power settings and frequencies make a difference in the results of the tissue. I think that's very important as far as learning how to use the laser.
Absolutely. Earlier, Gail replied to information that the Academy of Laser Dentistry is getting a lot of questions, and that was a question that was brought up to us, that when they get those questions, which ones are being allowed to use lasers? Who's going to answer these questions as they come forward to the Academy of Laser Dentistry? So right now, those have been sent to our Regulatory Affairs Committee. So Dr. Brewster and myself are the ones that we're co-chairs of this, and so we address these questions that come into place. We feel that it's up to each state to decide, and since the ALD is fielding many questions primarily by hygienists, we have created a report that links each state's dental practice licensure regulation as if to lasers were being addressed. What they're saying about lasers, and if anything else, where in their SPA information that they can find this information. We would love to hope that we could collaborate with each state to provide this information in a very easy and informative way to answer the people's information and questions that they have regarding this topic, since it's so huge. Dr. Brewster, once again, can you touch base on that as far as maybe some of the things that you've noticed with that?
Each state defines the scope of practice for the doctors and hygienists as far as what's done in their scope of practice. We are not here to help make regulations or to advise on that. We are here to provide information to help you make your decisions for your state and for the public safety issues.
And Gail, anything back with ALD as far as on the executive side and your team that stands behind you on how you can handle those things?
Well, I think the only comment that I have, Angie, is that for our listeners is to realize that this is a challenge for us for the ALD to keep up with this data. So we do hope that we can work together with some of our states to understand what it is that's happening in their jurisdictions.
Perfect. Which kind of led us into maybe not more of a question, but we as the Academy of Laser Dentistry are looking to states to help us provide their interpretation of their rules. As Dr. Brewster mentioned, we're not there to make the regulations, but we actually want to be able to help provide that information as a link to the hygienists and the doctors who are asking these questions. So this is where we need your help. If we can provide you the information that we've already gathered, Our committee has worked hard on kind of going through every state's Practice Act and finding out the information that we have. We would appreciate to have you look over your state's data and then email us to let us know if we have interpreted your regulations regarding the use of lasers correctly before we post it on our website. Some states have information and some don't. If we can all work together to provide that accurate information, all of our members, constituents will be very well served. We also ask if you could put us on your email list. Then as new regulations about lasers come into place, then we are able to stay abreast of that and be able to provide that information to members of the Academy or new potential members. Not that it's about that, but we want to be able to answer the questions to serve the public. After all, the lasers being used in a safe manner is what it's all about. And Dr. Brewster?
I want everybody to know that this was not intended to be a scientific podcast. We stand ready to provide greater details from the scientific perspective. Should you want that, we have people that help write all the rules. We have people who have been in the use of lasers for several years. We have a wealth of knowledge, and we will give you the information to help you make decisions or on your regulations. That is our basic goal.
Perfect. And Gail, if you could give us some information about the website that we currently have and what we're doing with that.
Well, the whole purpose for this report actually is to just make some information more readily available. You know, we all know how difficult it is sometimes when our doctors or just anybody in the public are trying to find out information, you know, on the web through regulatory agency documents. It's often very challenging. And if we could help them by pointing them in the right direction, it would help us to keep the information fluid. And also it would potentially help each state, other states, to see what other states are doing. You know, if we could, since the topic is laser technology, and we, you know, our association's focus is on the safe use of this modality, that perhaps there's some information that we can provide that will help each state's regulatory body in being that conduit of information for who's doing what, where, and all for the same ultimate goal. Thanks, Angie.
That's very true, very true. In closing, we just hope that we have been able to provide a basic overview of lasers from a regulatory perspective. We have covered laser safety, the basic concepts of lasers. Should lasers be considered as a different tool other than the tools that a hygienist can already use? Do we need to have any special training to be considered? Followed by what are states doing with hygiene and the use of lasers? We have expressed that ALD gets numerous questions weekly regarding which states allow use of lasers and how ALD has educational plans to be able to post our interpretation of what all states say about hygienists using lasers. We want you to know that we would continue to offer information to help you, your licensed individuals, everybody that we can, to get this information out to them in a timely manner as well. Concluding that this is something that we would love to have your suggestions and help so that we can have this information more readily available for the profession. Feel free to contact us if you find your board beginning to address these and other laser questions, and there's way more information that we can provide to you than what the board, from your board, as opposed to just these questions that we've been able to answer today. So Dr. Brewster, do you have any closing statements for us?
Thank you for your time, and thank you for listening, and I can only speak from the perspective of how the Texas board did. I think they did it right. I think they did a good example for y'all to consider if you're considering regulating lasers.
Very good. And Gail?
Yeah, I would just like to share that, you know, from my perspective, you know, we're dealing with change on so many different levels. You know, change in so many different levels of society. And, you know, change is hard. Change is good, and change really makes folks uneasy and uncomfortable. Technology is really moving faster than we can appreciate and faster than we might like. I was recently in a leadership forum where the speaker was talking about artificial intelligence, and way more than we all realize is really being developed from a technological perspective, way faster than we ever thought is happening, and it's all around us. And lasers and dentistry is just one aspect of change that's here, whether we like it or not, and it's challenging. So we hope that we can be part of that change, and help the society to reap the benefits of the technological change. And we thank you for the opportunity to share what we know and offer our future opportunities to talk with all of your listeners. Mr. Hedke, thank you very much. And Angie, it's been a pleasure, so thank you for inviting me.
Of course. Now, we would like to leave all of you with one last question for you to think about. If lasers are indicated for use, a question that we would ask you is, do lasers require a level of education that each state considers as a requirement to ensure public safety? So we want to leave you with that thought as you prepare or decide which avenue your state wants to go with lasers in the dental hygiene and the dental world. As we wrap things up, I would like to thank my panel, Dr. Keith Brewster, who obviously has helped with so many regulatory affairs issues, Gail Siminovsky, our Executive Director of the Academy of Laser Dentistry, and all of you who have taken your time out on a Friday to participate in this discussion about lasers. As we mentioned, if you have any questions, we definitely want to make sure that we answer those. And also, we definitely want to thank Mr. Richard Hedke for giving us this opportunity to speak to all of you regarding lasers, and we hope that we have met your expectations. So if any additional questions for us, please feel free to email them to us. You also have our email address that you can send to us after the podcast is over, and we, as a Regulatory Affairs Committee, will respond to you in a timely manner. So at this time, I would like to turn the microphone back over to Richard Hedke. Thank you very much.
Angie, thanks so much. I assume we don't have any questions that have come in. Angie and Gail and Keith, have any come in on your computer screen as of this moment?
I have not seen any come through, so either we've answered all their questions or they don't know what to ask us.
I think you did. I think you made a big mistake. The presentation was too comprehensive. You didn't leave any holes in the presentation, and now we don't have any questions. But that's okay. And, people should know, the audience should know, if questions come to mind, if you're half as bad as I am, you think of your best questions a day or two later when you're out taking a walk or doing the dishes or whatever, you can send them either to Angie Wallace or Gail, or you can send them to the AADB office. We'll get them down there to Angie and Gail. So questions that come up later, please email them to us, and we'll deal with them. I just want to conclude by thanking Angie and Gail and Keith. It was an excellent presentation. You used a lot of fancy, big words, which I didn't understand, but I'm sure the experienced professionals understood and really appreciated the discussion. I think one thing we did, we introduced our audience to the Academy of Laser Dentistry, and they got a little bit closer, got a lot more knowledge about the organization, and hopefully that will, as Angie and Gail suggested in their comments, open up a line of communication, and both organizations can help one another. I certainly am going to try to get one representative of the ALD either to come to our annual meeting in Atlanta in October this fall, and then maybe hopefully the next program we can have someone from the laser group speak during one of our continuing education sessions. I'm certainly going to try my best to do that for our membership. So that's it. That's a wrap. I want to thank everyone for dialing in. We're going to sign off right now. Thanks again. Goodbye, everybody, and have a great